Within the past 2 years, hospitals have seen an influx in patients presenting with respiratory distress due to the COVID-19 pandemic. Due to this influx, ICUs are overflowing with patients requiring ventilators and are overwhelming the healthcare system. So why do we care? Well, recent data shows that acute respiratory distress syndrome, or ARDS, has a 25 to 40% mortality rate in patients who are intubated. With a surge in patients and the limited capacities in ICUs, we're looking at ways to combat respiratory distress, to reduce intubation, and the strain on the healthcare system. Prone positioning has been a gold standard for intubated ARDS patients for many years, so I wondered whether non-intubated patients would see the same benefits and clinical outcomes. A clinical question asked whether awake prone positioning in adult ARDS patients would improve clinical outcomes. After a comprehensive search and critique was done, it was found that awake prone positioning significantly improved oxygenation with no associated harms. A single randomized control trial also found that it reduced the rates of intubation as well. I'm proposing to introduce awake prone positioning as a standard of care for all patients presenting with ARDS in acute medicine units, ERs, and ICUs. The ultimate goal is to improve their oxygenation and decrease the rate of intubation. Studies state that awake prone positioning should be done for a minimum of 4 hours, and therefore that is what I'm proposing to be introduced. For patients not tolerating the position for 4 hours, it can be done more frequently for smaller periods throughout the day. The first step is for you, the stakeholders, to approve the intervention. After that, staff and patient education needs to be done. Staff education will take the form of videos, online modules, and information posters with large pictures focusing on the benefits of awake prone positioning, recent evidence, and how to assist the patient into the position while maintaining all invasive lines. Patient education will take the form of informational leaflets in multiple languages and large posters with pictures of the position to be posted in all patient rooms. There are some barriers to this intervention. As I stated, not all patients will tolerate the intervention for 4 hours. In order to overcome this, it can be done in smaller periods of time, more frequently throughout the day, with the use of blankets and pillows for comfort. Another barrier is going to be time to implement. A task force is going to be set up to produce all educational aids in a timely manner and will be distributed to all staff. But there are some strengths and opportunities. Awake prone positioning, being introduced as a standard of care, will be highlighting Hamilton Health Sciences' ongoing quality improvement initiative. It is also extremely cost effective, and the large posters with the large photos will reduce the need for patients to be able to read and understand English. Hamilton Health Sciences prides itself in being world-renowned in research and patient care. Awake prone positioning could significantly improve patient outcomes and care. Thank you, and any questions?